Glandular fever, also known as infectious mononucleosis or the kissing disease, is a viral infection most commonly caused by the Epstein-Barr virus EBV, a type of herpes virus. It primarily affects teenagers and young adults, though it can occur at any age. The virus is spread through saliva, which is why it's often associated with kissing, but it can also spread through coughing, sneezing, or sharing utensils or drinks. Symptoms: the symptoms of glandular fever can vary in severity and often develop 4 to 6 weeks after exposure to the virus. Common symptoms include fatigue. Persistent tiredness is one of the hallmark symptoms of glandular fever and can last 4 weeks or even months. Fever. High body temperature fever, often between 38 degrees C and 40 degrees C, 100.4 degrees F to 104 degrees F. Sore throat. A painful sore throat, which may be severe and often mistaken for strep throat. The tonsils may appear swollen, red, and covered in white or yellow spots. Swollen glands. Lymph nodes, particularly in the neck, armpits, and groin, can become swollen and tender. Headache. Muscle aches. Swollen spleen. In some cases, the spleen may enlarge, which can cause discomfort or pain in the upper left abdomen. In rare cases, it can rupture. Liver involvement. Some individuals may experience jaundice, yellowing of the skin, and ice or liver inflammation. Hepatitis. Rash. The skin rash may appear, especially if antibiotics like amoxicillin are given mistakenly, thinking the illness is bacterial. Causes and transmission. Glandular fever is primarily caused by the Epstein-Barr virus EBV, although other viruses, such as cytomegalovirus CMV, can also cause similar symptoms. The virus is typically spread through saliva, which means it can be contracted through kissing, sharing utensils, or exposure to coughs and sneezes from an infected person. Incubation period. After exposure to EBV, it can take 4 to 6 weeks for symptoms to appear. Contagion. An individual with glandular fever can spread the virus 4 weeks or months after symptoms subside. Diagnosis. Diagnosis is based on a combination of symptoms and tests. Physical examination. The doctor may check for swollen lymph nodes, tonsils, liver, and spleen. Blood tests. A complete blood count (CBC) may show an increase in white blood cells. Monospat test. This rapid blood test looks for antibodies associated with EBV infection. EBV antibody test. Specific antibodies to EBV can confirm the diagnosis. Treatment. There is no specific cure for glandular fever, as it is a viral infection, but treatments focus on relieving symptoms and supporting the body's recovery. Rest. Adequate rest is crucial for recovery, especially since fatigue can be long-lasting. Hydration. Drinking plenty of fluids helps prevent dehydration, especially when fever is present. Pain and fever management. Over-the-counter pain relievers like acetaminophen, paracetamol, or ibuprofen can help reduce fever and relieve sore throat or body aches. Throat soothers. Gargling with warm salt water, lozenges, or throat sprays may provide relief for a sore throat. Avoid physical activity. Strenuous activity or contact sports should be avoided, particularly if the spleen is enlarged, to reduce the risk of spleen rupture. Complications. While most people recover fully from glandular fever, some complications may arise, especially in more severe cases. Fatigue. Persistent tiredness can last for several months after the acute illness, the condition sometimes referred to as post-viral fatigue syndrome. Splenic rupture. In rare cases, the swollen spleen can rupture, causing severe abdominal pain, and requiring emergency medical treatment. Secondary infections. Bacterial infections, such as strep throat or sinusitis, can sometimes develop on top of the viral infection and may require antibiotics. Jaundice or hepatitis. Inflammation of the liver can cause jaundice, but this is usually mild and resolves with recovery. Airway obstruction. In severe cases, Swollen tonsils can cause difficulty breathing, requiring medical intervention. Prevention: there is no vaccine for Epstein-Barr virus, but reducing exposure to the virus can help prevent glandular fever. Avoid kissing or sharing drinks with individuals who are infected. Practice good hygiene, such as washing hands regularly and avoiding sharing personal items like utensils or toothbrushes. Prognosis: most individuals with glandular fever recover within a few weeks, although fatigue can persist for months. Once a person has been infected with EBV, they carry the virus in their body for life, though it usually remains dormant and does not cause further symptoms. Conclusion: glandular fever is a common viral illness, especially in teenagers and young adults, characterized by fever, sore throat, swollen glands, and fatigue. While there is no specific treatment, most people recover with rest and symptomatic care. Awareness of potential complications, such as splenic rupture or prolonged fatigue, can help ensure appropriate management and recovery.